All right, I'm sharing, Cindy.
Okay, great. Thank you.
Yes.
Thank you.
Oh, we don't.
All right. So I'm Cynthia Bennett, and I'll be sharing this work on behalf of my co-authors, Shaun, Kane, and Christina.
Sorry, 1 second. We're trying to spotlight your video.
Yeah, she has nothing to go on. So.
No, Cynthia should be spotlighted. Not
Yeah, sorry that I'm speaking and a different person is presenting.
Okay.
So thank you.
Okay, perfect. You're all set up now. We can
Thank
see and
you.
hear you.
Awesome. So I'm presenting on behalf of my co-authors, Shaun, Kane, and Christina Harrington from Google Research. And thank you for supporting a virtual presentation. And I do apologize in between you and lunch, so I'll try to go quickly. Next slide. So disabilities and health conditions are quite common in the US. About 60% of people have a chronic illness and 28% of people identify as having a disability. Disabilities refer to systemic access barriers that people encounter between them and their environment. And it's also considered a culture and identity for some people. However, as you noted, a huge discrepancy in the numbers. Some people don't identify as disabled, citing cultural differences in how disability is conceived. Compounded oppression, such as experiencing racism, can make it unsafe. And so in this work, we expand the common adage of disability representation to include health and accessibility in order to understand these intersectional and diverse perspectives. Next slide. This research focuses on representational harms, a subclass of socio-technical harms consisting of beliefs about different groups that reproduce negative unjust social hierarchies. And there's lots of different ways misrepresentation can occur. Things like stereotyping, demeaning, erasing, alienating, preventing people from self-identifying and reifying essentialist social categories. Next slide. Why do we care about disability, health, and representation? Well, media has done a really horrible job at it, and AI is an incarnation of reproducing that. So for example, certain ways the bodies and clothing and movements of characters like the Elephant Man or Captain Hook are designed signify that disability communicates victimization or villain. And also disability misrepresentation can refer to inspiration and objectification, such as through this promposal, which is using a disabled person to inspire non-disabled people. Next slide. Text-to-image AI is proliferating. About 34 million images are generated per day, meaning there's a whole kind of exploding class of representation and disability and health that we need to be looking into. Next slide. And as we know, AI displays bias. Here's just a small number of the smattering of papers that show gender, ethnicity, nationality, racism, and disability-related bias. And so we build on this work. Next slide. And specifically, we are asking, what types of terms do people with disabilities, health conditions, and accessibility needs include in prompts to kind of signal for this type of representation? And how do they evaluate DHA representation through an iterative prompting process, like what they might be doing when they interact with AI image tools? Next slide. So we did a community-centered study where we invited 21 participants with diverse disabilities and health conditions to evaluate T2I models, use their self-chosen pseudonyms. They were randomly assigned to prompt with DALL-E or Stable Diffusion using kind of current versions at the time of data collection. And in this case, differing our work from others, they had complete editorial control over writing and editing their prompts. They could iterate on prompts as many times as they wanted, using their preferred language. We used semi-structured interview techniques to collect feedback, to understand their expectations, positive and negative feedback on the images, and how they would improve them in the future. Next slide. Importantly, and also different from prior work, we ensured that our study was actually accessible. A lot of AI image tools do not completely conform to accessibility guidelines, and some of them are not free. So we prompted 4 participants, but engaged in a careful proofreading process where they could edit and correct us, and we did not submit the prompts until they verified. We also kind of kept things flexible. Again, they could prompt as long as they wanted or stop when they wanted, and we provided image descriptions, captioning, and ASL when needed. Next slide. So I'll share some findings. We categorized the terms that participants used in prompts, which could illuminate future design and mitigation opportunities. We show some intersectional disability and health tropes that we found, and we share the impacts of prompt engineering on the representation quality. Next slide. So we learned that there were actually a lot of different categories of terms that participants used in their prompts, and we inductively coded all the prompts to develop these categories. Often research includes just the general disability terms, such as disability, invisible, blind, or deaf, but actually participants prompted for a lot of other types of terms, including the names of health conditions like chronic migraine, symptoms or the ways their bodies or minds might be working or not working, like ankle weakness or overstimulated. Access technology, the tools that they use to make the world, to kind of work through access barriers like canes or other technologies, accessible communication like American Sign Language, accessible environments such as disability-friendly apartment buildings. Um, Activities was a very interesting one, where when participants paired an activity word with a disability term, they expected to see that activity depicted in an accessible format. And so sometimes general terms could be impacted by the co-presence of disability terms. And finally, there was community activism, again, showing the culture and identity space of disability and like things like disability advocates. Next slide. So I just want to highlight a couple of things from the different terms of categories. While participants most often wanted to see a variety of image depicted to show the diversity of disability experience and health condition experience, they also recognized in certain cases very stigmatized experiences. They expected more narrow representation. So in this image, there are no markers of a health condition. And in this case, referring to HIV, LSF said fierce. It's a normal person who's happy living his life, which reflected the fact that the condition can be undetectable and was very important for LSF to see. Next slide. Participants emphasized needing to see nuanced reality over tokenistic presence. And so the images of wheelchairs on this slide, although disability marker was present, they lost their value as a representation marker because they were unrealistic and tokenistic. So for example, accessible yoga would not be depicted in this manner, rather maybe blocks or ASL instruction might be shown. And similarly, this way wheelchairs are portrayed on stairs kind of turned the representation into a negative because the presence of wheelchairs was emphasized over the accuracy. Next slide. So we encountered some forms of intersectional tropes that are much more detailed in the paper, such as carbon copy bodies, disability conflated with whiteness, and what I'll exemplify here, upper class defaults. Next slide. So participants identified that scenery tended to have an upper class ethos. So LSF commented on this kitchen. For the T2I tool, this seems like an ideal kitchen, but not everyone has this type of kitchen, honey. And so we have a tension here where maybe showing less affluent decor could also signify other stereotypes, but also concerning disability. A lot of kind of accessible spaces tended to be depicted very spacious and suburban in ways that did not represent the ways that participants were making their living spaces accessible or their realistic living situations. Next slide. Next, I'll move on to share how prompt engineering did not improve images. So successive prompts didn't correct inaccuracies, and successive images could sometimes re-render defaults. Next slide. So successive prompts didn't correct representations. So for example, participants were often unable to remove or correct mobility aids. One of our participants, Tony, tried to remove a wheelchair in 8 successive prompts using phrases like no wheelchair or wheelchair equals 0. Gargi said, let's give up on not showing the wheelchair. So this kind of extends research on invisible disabilities and the ways that people are often disbelieved or gaslit or made to prove that they have a disability. And the act of iterative prompting kind of brought this to the fore in the way that although they were trying to produce an accurate representation, the models were not supporting that and kind of extending this kind of narrow-mindedness about what disability looks like. Another example is John uses a mobility cane and wanted that to be depicted, but instead the incorrect kind of support cane was rendered even after he prompted several times to get rid of it. Next slide. Next, we noticed that successive images could re-render defaults, and this was particularly harmful. Again, expanding representation harms from something that people consume to the way they are compounded through co-creation with image models that do not recognize what the users are prompting for. So in this example, LSF is kind of iteratively prompting and wants to depict people with a multicultural background. And in the second image, the people have different races. However, in the third image, he added another specification for age differences. And again, 2 white people were shown. And so this kind of demonstrated the model's inability to recognize complexity in participants' prompts and kind of reiterated the representational harms by reverting back to showing default white imagery. Next slide. So as T2I expands, representation is lagging. As I demonstrated, prompting representations were often tokenistic and non-diverse, and prompting did not improve images. And next slide. So just kind of sharing some paths toward improvement. So we often think about like data collections, and one of the ways that community-centered efforts could help is in diversifying the ways that we conceptualize of certain representations. And so as we noticed, there were a ton of terms that participants used to prompt for disability, health, and accessibility. And these are very local and specific to people's communities and could impact evaluation or accountability metrics in terms of when we evaluate or assess disability or health representation. What are the types of things and the range of things that we need to look for? There's also opportunities to kind of use these examples to improve human AI interaction in terms of the models were incapable of processing things like invisible disabilities and recognizing when, in certain cases, invisibility was more important to images versus showing those direct markers of disability. And yeah, I think I will stop there. On the next slide, thank you so much for listening to my talk. I apologize it was so quickly. You can download the paper using the QR code. And if we have any time, I'm happy to take some questions.
Amazing. Let's give a round of applause. So we have time for a few questions. Okay, I see one hand over there.
Yeah, thank you for your talk today. This was informative and pointing out definitely concepts about representation and image generation. I have a question, and I'm wondering not so much to answer the question, but how you would recommend having this discussion. I see when you're talking about defaults in, say, image or text generation, a language model would come up with a distribution of outputs, and that distribution would be both context dependent about appropriateness as well as based on the distribution of the input data and who the target audience is. So under certain circumstances, if you want fully creative freedom, you'd be okay with, say, just as a case study here, a generation of Black Hitler. In most circumstances, depending on the use case, we would not expect that to come up. So there are a lot of different factors, and you talked about community engagement, but I'm wondering how you would have that discussion to go about determining which nuances matter for particular use cases. Thank you.
Yeah, thank you so much for this question. And I haven't put in as much thought into this specific question as I probably should, so I appreciate the provocation. I think, again, like, not to say like community-led everything, but that would be something. So I could, like, for example, I had someone in a different audience say like, oh, well, upper class defaults is problematic, but it's also problematic if the models are showing, you know, people of color consistently like in impoverished situations. That is also harmful. And so I think those are the type of complexities that, you know, working with people to understand like in which cases it's important to show something that might be a realistic, or in certain cases, I think this also argues that like singular media outputs may not be enough, like offering more context and ways to preserve keeping context together, such as like images and prompts or creative kind of understanding of where the creator is coming from. And So I guess that's what I have now, but I agree that this is a much longer discussion. So thank you.
All right, thank you. Do we have any other hands or questions for our speaker? All right, with that, let's give another round of applause. Thank you so much.